You may have heard recently on some of the media about a new tumor associated with breast implants. I've seen it on the Today Show, I've seen it on some of the evening news. This is a tumor that we've actually known about for 10 or 15 years. It may have actually been around for decades. It is referred to as A.L.C.L, which stands for anaplastic large cell lymphoma. But I think just remember the letters A.L.C.L, and that's how it's being referred to as. This is a tumor that is associated almost entirely with textured surface implants. It is benign 85% of the time. I have been in practice for 28, going on 29 years, and I've used almost exclusively textured implants, and I've never seen a case. So this is extremely rare tumor, but the media is really blowing this up. It kind of reminds me of when they were very concerned about silicone gel implants, and they pulled them off the market, and now they are by far the most common implant that we use. And I think we're seeing the same hype and concern about this. This is a tumor that forms around textured implants. It tends to present 8 to 12 years later as a breast that just starts to swell for no apparent reason. And I've been telling my patients the trick is, if that occurs, come to me or come to a board certified plastic surgeon who knows what they're doing. You sample the fluid that occurs around the implant, send it for testing. If there's this lymphoma cells in there, you take out the implant and take out the scar around it, and that cures it in virtually everybody. Patients have gotten into trouble when they've gone to a doctor who didn't know what he was doing. They've drained the fluid, they've left the scar in around that implant, and the scar is where that tumor forms. And then there have been cases of that occurring, changing into a malignancy, even requiring chemotherapy or radiation. My understanding is there have been 9 deaths associated with this. But the current statistics are there's about 38 million women with textured breast implants. There have been about 500 cases of A.L.C.L. They're virtually all curable if you catch them early on. And like I said, I've been in practice for 28 years. I have yet to see a case. I had a mother and her daughter come in, and they're concerned about A.L.C.L. The chance of A.L.C.L. occurring with textured implants is 1 in 30,000 for some implants, 1 in 200,000 with some implants. I can take those implants out and I can put smooth implants in. Those have about a 1 in 10 chance of forming scar contraction we have to go in and operate on. With any surgery, there's about a 1 to 2% chance of infection we would have to treat. And then I see almost monthly, if not a couple times a month, smooth implants that have fallen out of position or moved out of position. I had a lady not long ago. She came in with smooth implants in. One was contracted up hard as a rock and one had slid down and underneath her arm. Well, that's a textbook picture, in my opinion, of some of the complications associated with smooth implants. So I have a hard time justifying taking out a textured implant that may have a 1 in 200,000 chance of developing a tumor that is curable if you treat it correctly, and in exchange have a procedure that has a 1% chance of infection, 10% chance of scar contracture, and the chance of it moving out of position. And you have to keep things in a frame of reference. There's a 1 in 9 chance of developing breast cancer. There's a 1 in 105 chance of dying in a car crash, and a 1 in 30,000 to 1 in 200,000 chance of developing this tumor that for the most part is a benign procedure that is curable by excising the scar.